This is Conrad Robert Murray. Dr. Murray is present in court with counsel, Mr. Chernoff, Mr. Flanagan, Mr. Gorgian, Mr. Pena. The people by their counsel, Mr. Walgren, Ms. Brazil. Detective Scott Smith, once again, is on the witness stand. All the jurors and the alternates are present as well. Good morning, everyone. And to the jurors, good morning, ladies and gentlemen. Hopefully you had either a quiet day off or a productive day off at work yesterday. And once again, thank you for your continued courteous behavior and your patience. Detective, good morning.
Good morning, sir.
Do you acknowledge, sir, you're still under oath and still sworn to tell the truth?
Yes, sir.
Thank you. We're going to have a resumption of the playing of the audio, Mr. Walgren.
Yes, Your Honor, and I believe we were on page 86, somewhere around line 13.
We'll restart. Page 86, approximately line 13, ladies and gentlemen.
I've actually queued it up a few seconds prior to where we ended up.
All right, let's give the jurors just a moment. Are all of you on the page? Affirmative? Yes. Thank you.
Thank you, Your Honor.
And you were doing that successfully the 2 nights prior. Some little restlessness, like you mentioned, but everything was up until this night. The night that this happened.
Can't go back.
And he's just wide awake after you've done what you could for him.
Yes.
And he's requesting more, and then ultimately he requests the milk.
Yeah. Okay. So what I did at that time, I realized that maybe even though they have not studied that agent like that on a regular daily basis to a patient, and studies haven't shown that you can develop dependency, he was signs of a withdrawal. And whether that was all physiological, psychological, or mental, his dissatisfaction that he wasn't getting the milk, probably was involved in it, in that process.
So at the hospital, when they pronounce him and the other detectives talk to you for a little bit, what happens then? What do you do?
What did I do after talking to them?
Yeah.
Well, after talking to the detectives, I give them my cell phone, where they can contact me. It was now very important to console Mrs. Jackson, the mother of Michael. I had never met her before, but when she came into the hospital, the first thing was, how do you bring the news to her? I was also told that she had a heart condition. So I then asked them to be very, very careful in giving information to her. Was there any other family member present at the time? No. She was the only one there. His father was either in another state, but clearly not close. And I can't tell about the other siblings. But
did you leave the hospital, or did she come to the hospital?
She came to the hospital. So they brought her into a room down the hall, and I went in there with the emergency room physician who was treating her, whom I was with all the time through his code, and we were going to break the news to Mrs. Jackson. So the doctor started to tell her that, her son came in and he was having difficulty breathing, and they tried everything, and she said, well, how is he? He's not dead, is he? And the doctor said yes. And she broke down, very weeping. We stayed there, held her hand. The doctor left. I stayed, and then I asked for the social workers to come in, or psychologists, whatever the hospital had. They brought the social team. They brought the head of psychology, and I asked them to, based upon the news that Mrs. Jackson received, to please help her, take care of her at this time. My next question was, where are the children? I was not aware that the children were brought to the hospital. I was told that they were in another room off-site and they were having something to eat. They said the children had to be made aware of the condition, and they needed to know. So how best do we do it? So I spoke to Frank DeLego, he's Michael's manager, Frank DeLego, and he said he would go in there with me. I said, well, let's get someone else too that they pretty well have good camaraderie with. And this was Brother Michael Amir. So Frank DeLeo, myself, and Michael Amir, with a social worker, went into the room where the 3 children were having something to eat. I walked in, and I'm not sure who spoke first, but somehow the other they asked the questions, and the children found out that Daddy wasn't doing well, that he had passed away. And then they really were weeping, really weeping. I stayed there, I hugged them all, give them comfort to Paris, comfort to Prince, comfort to Blanket, which is the last little guy, because whenever they were sick, they would always ask for Dr. Conrad. Please call Dr. Conrad, Daddy. And I gave them comfort. Mrs. Jackson was not in that room. The Mrs. Jackson, his mother. After they cried and cried and cried, his daughter uttered a lot of words of unhappiness, and she knew she would live alone without her dad, and she didn't want to be an orphan. And real sad, real sad. She's like my daughter. And I told her, we will take care of her. Frank Durand said that he will take care of her also. And she asked me, Dr. Murray, he said, you save a lot of patients, you save people with heart attacks. You couldn't save my dad. I said, I tried my best. And she said, I know that, Dr. Murray, at least I know you tried your best. I know you tried your best, but I'm really sad. I wouldn't wake up in the morning and I wouldn't be able to see my daddy. And she cried and was very sorry. And then she asked to see him. And then that was another thing. How do you let the children see him? So before I said yes, I pulled the psychology team together. Yes, I'm doing all of this. And I said, we need some help and we need some backup here. The children need to see their daddy. Do you think it is a good idea? I did not make an independent decision in that case. And then somebody said, well, yes, they should bring closure to this. I said, do you think that they're mature enough to understand it? They say, yeah, they think so. So I had the social worker talk to the children some more. She brought some assistants down. And then they moved Mrs. Jackson, Michael's mother, to a larger room, big conference room. The children also joined the grandmother because she wanted to see grandma. So she went to the grandmother, and she was sobbing and weeping, and they helped a little bit, I think, grandma, but I'm not sure how close they are, because the 2 boys are still kind of running away from a distance, and Paris was more comforted by a relative versus the grandmother, but she didn't want to see her. And while that was happening, I asked them to prepare Mr. Jackson's body, make it as presentable as possible, because I recommended an autopsy be performed, so that the children would be able to view their daddy and at least say goodbye to him at this time. At that time, his family started to trickle in. First person I saw was his brother, Jermaine, I think. I didn't know him before. Some cousins, and then Latoya, his sister, came in. She saw him and they wept, and the family met together. And then, while they were preparing, Mr. Jackson says after he's pronounced and they're getting him ready in a different room, I went into the bigger room with the family, the big conference room. I sat with the family. Mrs. Jackson, I pulled my chair all the way up to her. The toy was right there. I held their hands. I asked them if they had any questions. Is there anything I can do to help? They asked me, do you know why he died? My answer was no. And that's the reason why I was recommending to the family to have an autopsy, because I also wanted to know. The questions were not very deep, and they were not anything, but I wanted to be there to answer anything that they wanted, any questions that they may have had, and I did that. After that, the body was ready for viewing. The social workers had control of the children, and they took the entire team, including the head of the department, who stood outside in the hallway, and they went in to see the dad. I also went into the viewing area. There was an officer standing there with me, and there was another glass partition on the other side, and they spent a long time with the family, with the dad. They cried. Other people came in. I went back to the big room, because at that time, after the children had seen the dad, and Latoya and Sue had viewed the body, they were wondering at that time still, would there be more relatives coming? Because they said that there was a 2-hour window, at which point they had to move him to the coroner's office, or the coroner would be there. So I went back into the large room, and I asked Mrs. Jackson if she had a desire to see him.
Mrs. Jackson.
His mother.
His mother.
And she said no.
The dad is there now?
No.
No.
No, he never showed up. So for the next part, I asked the security guard to say, well, what's going on? Well, now that, the family has been here, Mr. Jackson's there, they viewed the body, and now they're waiting for a coroner to move the body back. Would you be able to take the children home? What are you going to do? And then the security guard told me that, well, nobody could go into the home at this time, that the house was basically on lockdown. So I said, well, where would the children go? They were then trying to figure out, well, where they would go with which relative. I was not in charge of that. I waited around again for a while, and then I went to Randy Phillips, which was the CEO, president of AG Life. I then spoke to Frank Delano again. I spoke to Brother Michael Amir and other security guards. Is there anything else I can do around here? They said, no, Dr. Murray, we are told now that we may have to be airlifted out of here because of so much of the crowd that's outside. That was the situation I had. So then I asked for his brother Jermaine, and so they say he was in the other building. So I walked across another part of UCLA, and then I was introduced to the lawyers of the Jacksons, who was there for a number of years, and some of the press. And they wanted to make a press release. But they wanted me to review the press release to see if it was okay with me.
Jermaine did?
Yeah, Jermaine, and AG, Randy Phillips wanted me to look at that. And the lawyers they wanted me to look at what they had written. And I knew what they had written, and I added it. I added that the cause, although he came in with what was presumed to be a possible cardiac arrest, the underlying cause of that condition is not known until an autopsy is performed. And
Who is this you were talking to, Jermaine?
I was speaking to the press release and the lawyer who was preparing the statement for Jermaine to give. I then, after doing that, I thought it was reasonable. If they wanted to change anything and it was legal, Jermaine wanted to change the fact that they had asked the fans to respect their privacy. And he said that wouldn't be a very good idea because the fans are the fans. Maybe we should ask the media to respect our privacy. So he got rid of fans and added media privacy. And then I went into him further, where he was sitting in the corner, and then I spoke to him again a little bit, and then he asked me where I was from, and I told him I was born in the Caribbean, in Trinidad, because he heard my accent. And I said, anything else I can do for you? And he said, no, the family will try to do their best in this condition. I asked other people, is there anything else I can do around here? And they said, no. I was then tired to say, okay, I'm going to try to make my way home. And I left the hospital.
You spent time with Mrs. Jackson too?
Mrs.?
Yeah.
Oh, yes. Yeah.
Because Jesse Jackson said you should have spent time with the family, giving them comfort in the last hours of their son.
You wouldn't believe how sad it is to sit there and see the news report that comes around and it's so far from the truth.
We realize that.
They said that I left the car, I ran away. I was in the truck with Mr. Jackson trying to help him just about. I was doing everything I can. And I couldn't take my car with me if I had to help him.
You spoke with the doctor, or correct, Detective Porsche.
He had a little fedora.
Fedora on him.
He's the guy.
Partner.
That's the one who.
White-haired guy.
That's the one who spoke to me at the hospital.
Right. Okay. And you provided him with your contact information and an initial statement.
Yeah.
Basically, what you told us.
Yeah.
Obviously, not as in depth. We had tried to get a hold of you several times. And it just would go straight to voicemail.
But then your voicemail's filled. I even tried texting you a couple times.
Well, I
Is
think
this Friday morning? Is that
The same.
This would be that evening.
the same day.
Yeah, same day.
Yeah, Thursday evening.
I'll let you know that all morning Friday is when he's talking. It's very early in the morning. And so it was my advice to simply leave your phone off, talk to me. I had a busy day. I was running around doing 3 different things, listening to this story. And so I told him that we would wait for me to talk to you later.
Okay.
And then I didn't want to be bombarded by the number of people trying to reach me on my cell phone.
Being Michael's on-again, off-again physician, are you aware of any pre-existing medical conditions that he had? I mean, you talk about him being possibly addicted to these agents, but anything that you're aware of, any problems that he had?
Well, as far as problems that I treated him for pneumonia.
Okay. When was that?
I think sometime in 2008. Or 2007. 2008, I can't say for sure. I treated him for a fractured toe, a presumed fractured toe. When he was upset in his house, he did for some reason, and he kicked his door in and hurt his feet.
Remember what year?
That I think was 2008. And other than that, I treated him for like upper respiratory viral syndrome, weakness, and a little bit dehydrated state because he don't eat very well.
Was it kind of chronic with him?
What?
The dehydration and
He don't drink. He don't
fatigue?
drink and eat. He says all his life his mother's had to force him to eat as a child, so he just don't like to eat foods. And the foods that he eats when he eats is mostly chicken and rice.
What year was it when you treated him for the upper respiratory viral syndrome?
2007, 2008. It was. Oh, you mean the upper respiratory? That was the very first thing I treated him for. That was like a viral illness that was infecting the children and himself, and they were coughing and runny nose and not drinking enough and not getting enough rest.
That'd be about 2006.
Yeah, that was the first time. And I probably treated him a couple of times, maybe 2 or 3 times for that condition.
And then he had some blot on his foot.
Oh, yeah.
But that's probably not what you're
Well,
Yeah.
as I looked
I'm sorry, go ahead.
As I looked at his feet over the years, as a dancer, he had calluses that was so deeply engraved in his feet, and it would be so painful when he danced. I got a podiatrist to come to the house, so they did carve out the callus so that his pain went away. But at the same time, while looking at his feet, he had very severe onychomycosis, which is fungal infection that took over every toe and had gone into his flesh.
And when did you notice that?
On my examination.
When was this, though? How long ago?
I noticed that initially when I first saw him, and he had his socks off. Within the first year I saw him, I saw that as a condition. And we talked about it. We got his calluses to come off first.
But how long ago? What year? What month? Was it this year? Within the last few months?
No, about I'd say maybe a year and a half ago.
One of the important things about this, you might want to tell the ME, is before he treated it, he treated it with Lamisil. They do sell it in cream, but the thing is, if you take it orally, it's pretty tough on the liver.
Lamisil?
Lamisil.
So he did a full blood workup on him to make sure his liver and everything was within range. So
Correct.
at least you have that available. It was done on a fake name because it didn't like any of that info we're getting out.
Right.
But everything was in range, right?
Everything was fine.
Yeah.
And then I gave him the 3 months of the Lamisil, and kept checking with him to make sure that he was complying. But he was very happy. At the end of the 3 months, his infection in the foot, his skin was soft. There was no more exfoliation, no hardness. The nails had grown over new. He was amazed. He was very happy with that.
Yeah. Is there any, I'm not asking for any trade secrets, but is there any preliminary toxicology at all?
No, not that they even shared with
In
us.
the event, there's some, since we don't know what's going to show up, so we can feel like the tissue, these 3 drugs are going to show up. Were you aware of any other medications he was taking?
I was not aware of any other medications that he was taking, but I heard that he was seeing a Dr. Klein 3 times a week in Beverly Hills. And he never disclosed that to me.
You heard from who?
His staff, like Frank Delano, Kenny Ortega, different people that work on his production team, that he was seeing him 3 times a week. Right about 3 weeks ago, desperately around noon, he was calling for someone at Dr. Klein's office. He called Brother Amir to call Dr. Klein's office. He wanted to speak to a special person there. I think the name was Jason. And wanted Jason to see if he can squeeze him in, around the other
Is
patients.
this something Michael told you?
I'm there while he's doing this.
Oh, he's doing it.
Yeah.
Did you ask him what he needed?
That he wasn't disclosing. I mean, that's his own personal preference. He's in charge of his medical history. He never declared it to me before, but I'd seen bottles of pills at his bedside that had Dr. Klein's name on it. I also saw like a Dr. Metzer name on that, so I realized that he's also seeing other physicians. But he does not disclose to me.
I'm going to give you the names of some, I'm going to butcher the names of some medicines, and you can tell me if it's something that you've treated him with. We've already covered the propofol. Propofol injectable emulsion, 1%. That's
Lidocaine, that's called the anti-burn.
right. The flumazeno.
Fumazino, that is the antidote that I gave him.
Right, the
0.2
antidote.
to try to reverse the effects of the benzodiazepines.
All right. The clonazepam. Is that something that you had issued?
Clonazepam, that's what's the other name for that? Is that Restoril? Well, how many milligrams is that?
It is. I don't know.
Yeah,
I just know
I may
that-
have prescribed clonazepam, which is Restoril, which is a 30 milligram pill that he should use at night, PRN, if he, as needed,
Okay.
should he wish to sleep.
Okay. So that would be for sleep. Okay. Trazodone.
No, I did not prescribe that.
What is it?
Trazodone is basically an antidepressant that may also cause some sedation.
Cause what?
Also may cause sedation, help you to sleep, but it also treats depression.
It's not a MOI, whatever the hell that is.
No, it's not an
MOI
not
inhibitor?
not an MOI.
It's that first type of antidepressant.
It's called an SSRI. Yeah.
All right. I got a couple more. Just let me take some notes. You have a question in the meantime, Scott?
Yeah, but go ahead. I can.
So clonazepam, you may have.
Yeah.
Trazodone, no.
No.
Diazepam.
Yes. I recently prescribed that for him, very first time.
Okay.
Which is Valium.
Right.
And that again was one of the efforts to try to get him off the milk.
Lorazepam.
That's IV. That's the oral form of the IV Ativan. The same thing I'm giving him.
Oh, okay.
Yeah.
Oral
if
form.
the pill does not work, because when you take the medicine by mouth, about 70 to 80% becomes available in the bloodstream because of absorption.
Which says the oral form of.
Of the lorazepam, remember that Ativan that I was giving
Oh yeah,
him?
right. Ativan.
Yeah. The fact that it wasn't working orally, I was wondering whether or not if you give it to him IV, he'll have a better constitution of blood, would that help him to sleep? So that's why that came into play.
How about Flomax?
Flomax, I gave that to him.
Okay.
What's that used for?
Mr. Jackson had trouble urinating. He would describe, and again, he never disclosed everything to me. This was late in the course. Over the last few months, he explained to me that when he went to the bathroom, it would take him hours to urinate. You can come in there, he would actually wet himself down. People would leave him there and come back, and he still couldn't go to the bathroom. And I said, really? You've had that? I did check his PSA before. It was his prostate-specific antigen being a black male, and it was within range. So I thought that he had benign prostatic hypertrophy, because if it's elevated, you think other things. And so Flomax is a very good medication that will shrink the prostate and allow him to have a proper stream. So that's basically why he started that.
All right, now nystatin cream mixed with some steroid. Is that something that you gave him?
Nystatin?
Nystatin with
Maybe triamcinolone.
That's the stuff.
I did not give him that.
Okay.
He probably got it from somebody else.
What's that used for?
That is sometimes the nystatin is an antifungal agent. The triamcinolone is a corticosteroid. I don't know if he's having some kind of jock itch or something as it's going.
Like athlete's foot?
Yeah.
Athlete's foot, not necessarily, because that's cleared up.
Okay.
His feet is cleared up. And he did not have any residual athlete's foot or anything like that. So he's using it for something else that I don't know. It could be a jock itch or something like that.
Latanoprost?
What's that?
Latanoprost?
How do you spell it?
Latanoprost. It's an eye drop solution usually used for glaucoma.
Is it what it's called, Opcon A?
I don't know. Well, it didn't have any brand name. It just said Latanoprost on
I
it.
don't know. Is it over the counter?
No, it's prescribed.
If it's a prescribed agent, I don't know about that.
Any problems with his eyes? That you're aware of?
Exolatin.
What's it?
Exolatin.
Oh, that's somebody has given that.
Okay.
Yeah, Zolatin, right?
Whatever.
Yeah.
I'm not
Sure.
these guys.
Well, that's interesting too, because he never had seen an ophthalmologist. I was trying to
It
take.
came in 3 vials.
Really?
Yeah, 3 glass vials filled with liquid that you could use a dropper or you could use a syringe. But it is a prescribable one, but there wasn't the name of the doctor who's prescribed it. So.
Surprise, surprise.
Okay. How about?
Let's talk about that a little bit, because that's again another surprise for me. That's why I don't know exactly all that he has available to him. Mr. Jackson, I scheduled an appointment with Dr. Devan, somebody from UCLA, known to be very good at radio keratotomy surgery for the eyes. Recently, because Mr. Jackson buys these readers over the counter. He has magnification glass. He
Work great.
He can.
You lose one, you just replace it.
He has magnification glass. His eyesight was very, very bad. I decided to figure out he could be legally blind. His eyes was also very red. I asked him about glaucoma to see, because I'm trying to take care of him in general. And he says no, he doesn't have any glaucoma. And even when I spoke to him at that time, he never told me he was seeing a doctor that had given him any substance like that for the eyes. Just last week, I got this doctor from UCLA to see him. Last Sunday, they were going to open their clinic to do a complete dilation, look in the back of his eyes, check his fundus, and see what was happening, and see if they were going to give him any monocular vision or contacts, because I was worried that when he was in England, if you're not seen on the stage and all the bright lights, maybe you can fall and hurt yourself. So I encouraged them and him to have the eye examination. That eye examination was hopefully scheduled for last Monday.
So he had agreed to it?
He agreed to do it, but it never happened. I still have email from the doctor asking me to call and reschedule it. And one thing or the other led to that being put off, but his team, his production team, agreed that, it's something that he should have done. So I was trying to find out issues with Mr. Jackson and trying to address them in a gradual way, overall, to help him. And that was one of the things I discovered. So that medication is a surprise.
How about Vallisone?
Vallisone?
Yeah, it's a steroid cream.
Almost like a Vaseline.
Oh, no, I don't know about that.
Okay.
No,
For like
again,
some type of inflammation of skin.
Well, I'm told that Dr. Klein is maybe a dermatologist. I don't know. But his production team has said to me recently that his worst days on the set is when he had gone to Dr. Klein's office, which is about 3 times a week. And when he came back, he was basically wasted and required at least 24 hours for recovery. Now,
Is that Arnold Klein?
I don't remember. Klein.
Beverly Hills?
Yeah, Beverly Hills. So I wasn't certain, again, why he never shared with me. If you want me to be your team and overlook things for you, why would he have shared with me the fact that he was seeing a dermatologist or another doctor for any kind of treatment that he did not share? The only time I got hold of the activity trying to get into the clinic, that day when he said he had to go, it was very important. He was insisting on that. That's when he called around noon to that place, asked for Jason, and tried to see if he could be squeezed in.
How about Benequin?
Benequin, yes.
Okay, is this something that you think? Okay.
What is it?
Benequin, 20%.
What is it?
What does it do?
It's a cream made for bleaching or permanently removing spots that will accumulate on the skin. Like, for example, if one has vitiligo and you have blemishes on your skin, like dark or white spots that may develop, you can use Benequin. It takes for about 9 months of therapy. It's a very safe agent, and it can permanently remove the spot.
And we already covered the prior injection marks. That was something that you noticed yourself in your examination, and caused for his veins to harden and make it more difficult to find.
Phlebitis.
Yeah.
And that's another reason why I thought his cause of death could have been a pulmonary embolism or a blood clot migrating to his lungs.
Produces irreversible depigmentation.
That's why I said permanent.
Couldn't tell.
Now he also has something called hydroquinone, which is 8% cream, which is used for temporary removal of spots. It works more quickly, but it's not permanent. So he would use both in case there was a blemish. He would follow the 8% with the 20%. And, when the spot went away, he would then try to continue using the other one, so it doesn't.
We found a small portion of marijuana in his room. Did you know him to be a smoker?
No. Marijuana?
Which room? The one that you don't go into, or?
Yeah, the one you stay out of.
Yeah.
You don't know.
No. Okay. He denied so clearly. I felt, now that I'm finding out all of these things and it's piece by piece, I gave Mr. Jackson love. I was his friend. I cared about him. I tried to help him. That's all I was trying to do. And I feel let down to know that, he would be using things like that.
Well, the marijuana we found was old. It had already rotted away.
Oh, he rotted away.
Yeah.
It was in a suitcase, in a closet, buried. Family members came across it when they were cleaning.
So, it wasn't like a fresh joint or anything. It was something that had
who knows?
rotted. It's been,
I doubt that he would even pack his own suitcase when he went away. What about cigarettes?
No, he packed his suitcase.
Did he?
Yeah, I know that for a fact. He packed certain
Clothes
suitcases.
or other things?
He would pack certain suitcases that he went away because he would be familiar with where certain things would be, and he would want to know that and keep that exclusively to himself.
What about cigarettes?
I know them to smoke. He found cigarettes.
Empty packs.
Really?
In the same suitcase that literally it was raunchy, old, you couldn't even tell it was marijuana. In fact, we thought it was initially tar heroin. When we had it analyzed, and it's just decomposed basically marijuana, and the THC was present. But nonetheless, there was 2 empty packs of cigarettes in there. I know his family is definitely against that.
Wow.
But again, who knows?
But at the same time, no one went into that room. He wouldn't let anyone in. But he used excessive cologne, and I never understood how he sprayed that much on all the time. I'd be saying, and he just keeps spraying, and it could have been to dismiss any order. I don't know.
Mentioning some doctors, we talked about a Dr. Lee,
Yes.
and was she in Vegas?
No, she's here in California.
Where at? Do we know?
It has to be Los Angeles because this is where apparently she was coming in and giving him infusions at different times during the week. That's what he told me.
And then there was also the Dr. David Adams,
He's
who's in
in
Las
Las
Vegas.
Vegas.
We talked about a Dr. Klein, possibly an Arnold Klein,
Yeah.
in Beverly Hills. And then a Dr. Metzer.
In Beverly Hills too. That's what their prescription bottle says Beverly Hills. I think if you have the medication with you, you can look at the medication bottles and you'll find out.
How do you spell Metzger?
I think it's M-E-Z... wait,
Metzer?
something so. I think that's what I saw on the bottle.
Metzer?
Yes.
Yeah, it's Metzger with a G.
Metger?
Yeah.
Is that correct? I wonder.
What's H for you?
I saw it on the bottles of medicines at his bedside. So if you look at the bottles, you'll see the doctor's name on it.
Like METZGER.
Yeah. With, you'll see the prescription bottles.
The evening that this was going on at Mr. Jackson's house, his final night, these different syringes, or one syringe was used when you injected it into his IV drip down below.
Yeah, one syringe for that, yeah.
I'm sorry?
Yes.
One syringe was used for the various medications you gave him, or
No,
each time was it a...
No, I had two syringes, and I would recap them if I needed it, and I would use the medication and I would draw some saline to have the mix, and then I would infuse it. Yeah.
What did you do with those syringes when you were done?
But I usually have my bags right there, and everything I use, I would put it quickly into the bags, and I just put it into the cupboard because he wanted me to not have anything hanging around.
Where's your bag where those syringes would be at now?
Oh, really?
I don't have that.
I thought you left it there.
Yeah.
Where did you leave it?
In that same bedroom, in the closet where it always stays.
Which closet?
It's
a mess.
45 cupboards.
Yeah, if you walk into the dressing room and you turn right, at the high level top, the bags left there with the items in it and the medication.
Is that the closet that has the glass cabinets with his jackets?
Yes, but this would be two short stubs higher up there. He showed me that cabinet. He wanted me to keep the things there with my bags and so.
And that's where you left your bags that night?
Yeah.
Black?
Three
And
bags.
that
There were three. One is a little Costco blue bag. One is a black small bag. And then one is a little blue bag that has a zipper in it.
And you left it there because you went directly with the EMTs to the hospital and never went back to the house, right?
Oh, but it would have stayed there anyway until I came back the next night and helped him. Because it has the IV catheters and everything is in there.
And that was normal course of business for you? It's nothing?
Yeah.
You think of anything else?
I'm thinking that's about it. Okay.
Do you happen to have the key for the car? So I don't have to break into it?
No, don't break in the car.
Oh, we have to get into it.
But you didn't open the car yet? It hasn't been opened?
Oh, no, it's just been locked. So,
Really?
yeah. We didn't have a key for it.
I don't think I have the key on me. I hope I do.
That way, whoever comes,
yeah,
make sure
that would
they
have-
have...
Do you need a safe word for that? No, please.
Okay. It'd be easier if we had the key. That way we could, not damage anything. Because sometimes when the guys
Or
unlock,
you can
they
get a key,
disconnect.
an extra key.
Yeah, well, I have the one key here, and I don't know if Jack
We
has
got
the
what?
key.
Did you ever give them to him wrong? Okay.
I don't find any.
Yeah, we didn't find any.
But
I don't know how they...
there was a
That concludes the playing of the audio. 197. Mr. Walgan?
Detective, does that audio recording we've heard accurately recount the interview that took place at the Ritz-Carlton on June 27th, 2009?
Yes, it does.
Prior to that interview of the defendant on June 27th, 2009, to your knowledge, had the defendant informed law enforcement he had administered propofol?
No.
So that was the first you learned of that?
That's the first time those words were uttered, yes, during our interview.
And prior to this interview, you had reviewed the brief statement made by the defendant to Detective Porcher that was referred to in the interview?
Yes.
And in that interview, the defendant stated he gave a sedative?
That's correct.
Okay, but did not mention propofol?
Right.
Now, you described when we were here last week that prior to conducting this interview, you had responded to UCLA. You also mentioned attending the autopsy. And I believe you mentioned your knowledge was fairly limited as to what had transpired on June 25th.
Very limited, yes.
Can you describe this interview? In other words, in hearing the interview, there's very little questioning by you and Detective Martinez. Would you agree with that?
Yes.
Okay. You ask about certain medicines, you ask about certain doctors, but as far as the events of June 25th, 2009, did you have a particular tactic or thought in your mind to just allow Dr. Murray to tell you everything he knew?
No, at this time, we didn't have any answers, so it was more of an interview. It definitely wasn't an interrogation.
Okay. Were you allowing Dr. Murray to speak freely and tell you everything he knew about that night?
Yes, we were.
He didn't mention any of the phone calls we've heard about. Is that correct?
That's correct.
Did you have the phone records at that time?
No.
Were you aware of Ms. Sade Anding at the time of this interview on June 27th, 2009?
No, we were not.
There was a portion of the interview toward the end where you're asking Dr. Murray where the syringes are. Do you know to what I'm referring?
Yes, I do.
Okay. And he indicates that they're in his bags at the house.
That's correct.
Okay. And there's a audio in there of Mr. Chernoff saying, when it's stated that they have not been recovered by you, words to that effect, Mr. Chernoff states, "Oh, really? Were you watching the defendant at that time?"
Yes.
And did he seem surprised that LAPD had not yet recovered his bags?
Speculation.
The objection is overruled under 800 lay opinion.
Did Dr. Murray seem surprised that LAPD had not yet recovered and been in possession of his medical bags?
He seemed very surprised.
What did you observe?
An expression on his face like,
Kind of a startled, big-eyed look?
Objection leading his witness.
Sustained.
I'm describing for the record what he...
His own language for it.
Just a moment. We don't have to have editorial comments by the people or the defense. Re-ask the objection sustained. You can ask the witness.
Describe what you saw Dr. Murray express when he learned that LAPD was not in possession of his medical bags.
his eyes got bigger, wider, as if he was surprised, a look of surprise, just as Mr. Chernoff said, uttered, "Oh, really?"
Now, going back to the day prior, June 26, 2009, there are a couple additional items I wanted to ask you about. on that day when you responded to 100 North Carrollwood on June 26, 2009, and you described some of the items, the empty pill bottles that were recovered, the diazepam and lorazepam. Additionally, were there some business cards recovered?
Yes, there was.
And those were in the name of Conrad Murray as well as David Adams?
That's correct.
You're going to have two separate business cards. May the business card in the name of Conrad Murray be marked People's 198 for identification?
I think we're up to 199.
198.
Mrs. Benson?
Correct, Your Honor.
Which
Thank
one is correct?
199.
Thank you. 199.
Thank you, Your Honor. People's 199. And then additionally a card in the name of David J. Adams indicates anesthesiologist. May this be marked People's 200 for identification, Your Honor?
Yes, 200.
And these two items, Detective, People's 199 and